Over one-third of veterans have hypertension, making it the most common chronic medical condition among veterans. In a 2008 study, it was found that 13% of active duty service members had hypertension, the majority of whom were less than 40 years of age. Because blood pressure measurements in the outpatient setting are used in screening for hypertension and for monitoring the effectiveness of treatment, it is important to use proper measurement techniques so that blood pressure readings are consistent and reliable. This video demonstrates the proper techniques for both the automated and manual measurement of blood pressure in a clinic setting. It also emphasizes the importance of the VA/DoD Clinical Practice Guideline for the diagnosis and management of hypertension in the primary care setting, or hypertension CPG. The hypertension CPG is intended to assist VA and DoD healthcare providers in all aspects of outpatient care for patients with hypertension. The full hypertension CPG is available at this website. Measuring blood pressure. Key points. Whether you are measuring blood pressure manually or with an automated monitor, there are several key points to keep in mind. Smoking, exercise, or caffeine ingestion should not have occurred within 30 minutes prior to the blood pressure measurement. Prior to taking the first blood pressure measurement, an appropriate blood pressure cuff size should be selected. Applying a cuff that is too large or too small can result in inaccurate readings. Blood pressure cuffs are typically marked with indicators to aid in proper fitting. An index line runs perpendicular to the length of the cuff, and a range line runs parallel to the length of the cuff. If the index line fails to reach or exceeds past the marked range, a different cuff size should be used. An appropriately sized cuff will close within the marked range and still allow 2 finger widths under the cuff. An appropriately sized cuff can also be selected based on the patient's mid-arm circumference. Prior to taking the first blood pressure reading, the patient should be seated quietly for 5 minutes. During this time, the patient's back should be supported, their feet should rest flat on the floor or a firm surface, being sure to not cross the legs or ankles. The patient's arms should be unrestricted by clothing and supported at heart level. The properly sized blood pressure cuff should be applied to the selected arm, making sure that the artery line is centered over the patient's brachial artery. Measuring blood pressure with an automated blood pressure monitor. After sitting quietly for 5 minutes, the patient should remain in the correct position while their blood pressure is measured. The patient's back should be supported with their legs uncrossed and their feet resting on a firm, flat surface. The arm should be unrestricted by clothing, supported at heart level, and the properly sized blood pressure cuff should remain in place. The environment should be free from distractions or disturbances while measurements are taken. The patient should continue to sit still and refrain from talking, reading, texting, or watching television while their blood pressure is being measured. Make sure the tubing that connects the cuff to the monitor is straight. It should not be wrapped around the basket or stand. Any kinks can impact the blood pressure reading. Following the operating procedures for your automated blood pressure monitor, turn the unit on and initiate the blood pressure reading. If the patient is talking, laughing, sneezing, or coughing during the blood pressure measurement, the reading should be discarded and the measurement repeated. Average a minimum of 2 measurements, made at least 1 minute apart. Measuring blood pressure manually. Taking a manual blood pressure reading requires a stethoscope and a sphygmomanometer, consisting of a blood pressure cuff, a rubber bulb with an adjustable valve, flexible tubing, and a manometer that displays the level of pressure within the cuff. Prior to taking the first blood pressure measurement, select an appropriate blood pressure cuff size using the methods described earlier in this video. As with automated blood pressure measurements, Correct positioning of the patient is essential for accurate manual blood pressure readings. Prior to taking the first blood pressure reading, the patient should be seated quietly for 5 minutes. During this time, the patient's back should be supported. Their feet should rest flat on the floor or a firm surface without crossing their legs or ankles. The patient's arm should be unrestricted by clothing and supported at heart level. And a properly sized blood pressure cuff should be applied to the selected arm. The cuff should be applied 2 to 3 centimeters above the crease of the elbow. It should fit snugly, but still allow 2 finger widths under the cuff. Smoking, exercise, or caffeine ingestion should not have occurred within 30 minutes prior to the blood pressure measurement. Next, find the brachial artery, which is palpable about 4 to 5 centimeters from the medial epicondyle on the anterior surface of the elbow. Place the bell of the stethoscope lightly against the skin over the brachial artery, being sure that the pressure is appropriate for good sound transmission. Make sure that the blood pressure cuff and clothing do not touch the stethoscope. Inflate the cuff to 20 to 30 millimeters of mercury above the pulse obliteration pressure. Then deflate the cuff at a rate of approximately 2 millimeters of mercury per second while listening for sounds. Listen with the stethoscope as the pressure in the cuff decreases and blood flow in the brachial artery increases. When you hear the first thump, note the needle's position and record the systolic pressure. When you hear the last thump, note the needle's position and record the diastolic pressure. Let's visualize the systolic and diastolic measurements one more time while listening through a stethoscope. The blood pressure should be measured at least twice, waiting a minimum of 1 minute between readings and recording the average of the 2 measurements. Obtaining an accurate blood pressure measurement is crucial for your healthcare team and your patient. Please visit the U.S. Army Medical Department Office of Quality Management website and the VA DoD Clinical Practice Guidelines website for more information on the hypertension CPG and other hypertension resources for healthcare teams and patients.